Again, welcome to our guests who are coming into this webinar today. You are at the COVID-19 vaccine webinar with Concordia University. We will be getting underway very shortly. Welcome. We're so glad that you are here. Panelists will be getting started very shortly. Again, welcome everyone. We're going to get started in just about 2 minutes. Welcome to the webinar today. We are delighted to have you with us. We're looking forward to sharing great content with you today as we talk about the science, the medicine, and the ethics of the COVID-19 vaccine with some of our experts here at Concordia University. Panelists, we'll get started in just about a minute, so if you want to get your notes together, now is a great time to do that. All right. A little bit of a technical glitch. I'm seeing one of our panelists, Kevin, is messaging me. There you are, Kevin. I'm going to promote you to be a panelist because, you know, it's important that you're on the panel since you are a panelist. So I feel very powerful. I've just promoted you. And now that we have everyone here, we will begin. Well, good afternoon and welcome everyone to Concordia University. We are just absolutely delighted to take this time today to present for you expertise from our dedicated faculty and close friends of the university as we think about the science, the medicine, and the ethics with respect to the COVID-19 vaccine. You know, here at Concordia University, since the beginning of the pandemic, while we have had to toggle and shift and make so many unprecedented, unexpected decisions, like so many of you, we've lived into 3 core values for life, health, and wellness throughout the pandemic. With so much that is unknown, our values are something we know well. And today we have an opportunity to put before you the expertise of a fantastic set of panelists. And I am very excited to introduce them to you in just a moment. And they're going to lead us through some consideration of the impact of the vaccine and how we can think about it as we make decisions and choices aligned with those values for life and health and wellness. Today, as you participate, please feel free to use the chat function to interact with the panelists. If you have specific questions for the panelists, we will be taking those at the end of today's session, and we encourage you to post those using the Q&A function within the Zoom webinar. For those of you watching on Facebook, please feel free to interact within the chat and community function on Facebook, and we'll be receiving those questions as well. We won't have time to get to all of them, but we'll try to get to as many as we can. So friends, without further ado, I'm excited to introduce you all to our panelists today, and I'm actually going to put their bios right into the chat because these are just amazing people with so much to offer and such an incredible capacity to support our learning today. So those of you who are watching, you can look in the chat and see each of our guests who are with us today. And I think you will agree that we've got just a tremendous, tremendous slate of people with us. But I'm going to call out and introduce Dr. Leah Dvorak, who's going to serve as our facilitator today and guide us through our conversation. My role, Dr. Dvorak, is really to be host and timekeeper, to keep us moving through all of the fantastic content that we have to give today. So Dr. Dvorak, I'm going to hand it over to you right away as we get started talking about the science of the COVID-19 vaccine. Dr. Dvorak?
Thank you, Dr. Jameson. So it's a pleasure to be here today. I'm actually going to turn this over to our first panelist, who is a PhD microbiologist. So he studies very small things, which includes viruses. And his name is Dr. Justin Speck. Justin is a professor in our life sciences department here at Concordia. And he's going to talk about, and I'm going to ask him to tell us a little bit about the basics of the biology, the science of viruses, and then a little bit about the science of the immune system. So Justin?
Thank you, Leah. Yeah, in simplest terms, when we talk about viruses, they'd be considered parasitic particles. They're not actually living things. Their goal is just to get into a cell and replicate as much as they can. The actual infectious part of a virus is the nucleic acids. And these nucleic acids come in two forms, either DNA, so kind of like your genome is made of DNA. Viruses can have DNA genomes as well, or RNA genomes. The RNA genomes aren't as stable, and so viruses that have that tend to have a lot of mutations and change rather quickly. Now, outside those nucleic acids, there's a protein coat. It's called a capsid coat, and this helps protect the nucleic acids when it's not in a cell and getting it to a new host cell. And then outside that, we have two variations. You can have naked viruses that are just that protein coat, or you can have enveloped viruses that have actually taken some of the host membrane with them. But on the outside of that are spikes. And these spikes are really important. They determine the host range of a virus. And by host range, I mean what type of cells they can infect. Viruses infect every living thing on the planet. So there are viruses that infect bacteria, plants, fungus, mammals, fish, you and I, right? We're dealing with that right now. And obviously the closer you are in relation to another organism, so like we are mammals, and sometimes viruses jump from other mammals because those spikes are close enough that they can attach to your cells as well as another animal's cells. Now, viruses have two basic strategies. There are the viruses that are hit and run, kind of like the common cold you get. It hits you fast, tries to replicate as quickly as possible in your cells and spread to other people. And then you have the other type that are more persistent infections, where they get inside your cells and they try and hide from your immune system, and they slowly replicate. This would be more like HIV, would be a persistent infection that would slowly take over and try and hide. Now on the other side of it, we have our immune system. Our immune system is divided into the non-specific and the specific. The non-specific are kind of your physical barriers, chemical barriers like stomach acid. Also that you have some white blood cells involved in that. These are your baseline protection, but they're not quite as powerful as the adaptive immune system. Our adaptive immune system is extremely powerful and very efficient at removing infections. The problem is it takes quite a while for these to get going. The adaptive immune system actually has to see the infection first. The first time we see infection in a population, we call the population naive, because our adaptive immune system has never seen this before, and it takes quite a while before we can react to it. The two parts of the adaptive immune system are the B cells, which produce antibodies. Antibodies are great. Once you've been infected, every subsequent time a virus of that same type tries to infect you, these antibodies will coat those spikes and prevent them from getting into your cells and greatly limit any infection that might occur. And then we have the T cells. T cells go around and they actually kill any of your cells, your own cells, that are infected with virus. And they try and limit the infection and clear it by actually rooting out all those infected cells. These tend to be really important the first time you're infected because the virus has already gotten into cells and these guys have to go through and root them out. Yeah, there's some basics on what viruses are and your immune system.
So Justin, it sounds like there are many viruses in the world and most of them are not harmful to humans and don't infect humans. Tell us what makes the coronavirus so unique and so dangerous for people?
So coronaviruses are really interesting. Any microbiology textbook in their virology section, they're going to talk about the coronaviruses for a few reasons. Number one, 15% of common colds are caused by coronaviruses. So they're a really common virus type. They also have a single-stranded RNA genome. And what's really interesting is they have the largest RNA genome. So of all RNA viruses that we know of, coronaviruses have the largest genome. The other thing that's rather interesting, so more specific to these SARS and MERS, is that we can get these interesting variants of the coronavirus that instead of just infecting your upper respiratory system, they can get down into your lower respiratory system and cause significant problems. And these are the severe acute respiratory syndromes. And that's what we see right now, this SARS-CoV-2. And these tend to be what we call zoonoviruses, where they've jumped from an animal host to a human. And most zoonoviruses tend to have high mortality rates because the population has never seen these before. And we have a hard time responding to them. The current one we have has spikes that attach to ACE2 receptors, which are found in your alveoli on type 2 cells there. And these actually will damage these type 2 cells. These type 2 cells produce surfactant. So this is something that lubricates your alveoli. And without that lubrication, the alveoli have a hard time opening up. And so you get all these, basically you get collapsed alveoli and collapsed lungs then, and people asphyxiate, they just can't get oxygen.
Thank you. So I want to open it up to the whole panel now and ask all of you to think about how important do you think it is for average regular people to understand the science that's involved in this pandemic? Obviously, this group is pretty scientifically and medically astute, trained folks. How much do you think the typical person should know about the science that's involved here in terms of the biology of viruses, the biology of the immune system, and the way that vaccines work?
This is Kevin. I can maybe contribute something. I know in ethics, when I teach an ethical decision-making model to my students, the first step is to gather the facts. So it's really difficult to make a good ethical decision without knowing the facts. So at least a knowledge of the basic science, I think, is very important.
Let me take an answer here. Health literacy is extremely important for anyone. When you go in to see your practitioner and you want to make decisions about how you should be treated, having some basic understanding of what is happening with you, having some basic understanding of how the therapies have been designed and how the therapies have been tested are going to give you your best chance of working with your clinician to make the best decisions that you can on your own health, whether it's a viral pandemic, whether it's diabetes or hypertension. Plenty of opportunities now to become health literate with the vast amount of information on the internet, but be careful with what you see on the internet because sometimes it's just not that accurate. Going to a reputable source and then having face-to-face discussion with your provider is going to give you your best opportunity to make the right decision for your own health.
And piggybacking off of what Ernie was saying, understanding what's going on as far as how infections spread can help you be calm when the news tries to excite things, because the media tends to blow it up. If it bleeds, it leads. Like right now, we have new variants popping up. Well, there's really nothing else new or fancy we need to do. It still spreads through the air like the normal coronavirus has. Just keep wearing a mask, social distancing. We really don't have to do anything new. They just want to get us excited. So understanding what's going on can help keep you calm and not stress you out as much.
I'll to add to that, I'm a pediatric provider and a mom, and I think it's really important that as parents and as individuals advocating for ourselves, that we feel comfortable asking any question of our healthcare providers. There's nothing a parent or a patient could ask me that I would think would be a stupid question. And if it means that someone would ask for clarification in order to change their mind and perhaps get a vaccine that could save their life, I would want them to feel comfortable asking. So if you're not comfortable asking your specific provider, I would encourage you to reach out to someone on the panel or to ask from a different provider and get those questions answered.
And I would just echo everything that's been said and also comment that the more information you have and the more basis that you have, then the better you are to better position you're in to really weigh risks and benefits when we are faced with decisions every day getting through this pandemic. And whether it's deciding about an activity, deciding about a vaccine, all of us are making decisions every day in terms of, you know, what is the best decision for our families and how we can get through this, taking care of others and ourselves. And the more information and background we have, I think the better equipped we are to make those decisions in a very educated and meaningful way.
I would just like to echo everybody's comments that when this first hit, I was talking to close to 100 people a day asking, well, this is just like the flu, right? Or we don't need to be that worried about it, or that applies to other people, not me, or anything else that people came up with. The amount of misinformation, even today, is just overwhelming. And so I think that, you know, we need to be open, that people can come to us and ask questions. And one of my favorite questions is, that's very interesting. Where did you see that, or where did you hear that from? So that's a good starting point to find out where people are getting their information from, and we can build on that.
Awesome. This is so great. Leah, you see how we could just go and go and go. I am, like I said, I'm the timekeeper, so I'm everybody's least favorite person in these conversations. But I'm going to shift us now from this conversation around the science of the virus into a conversation about the medicine, right? So we're doing the science, the medicine, the ethics. So Dr. Dvorak, let's talk about that piece.
So to do that, I'm going to introduce our second panelist, and that's Dr. Ernie Stromsky. Ernie is a physician with many years of experience working at Children's Hospital in the emergency department there. Here at Concordia, he teaches in our School of Pharmacy and also in our physician assistant program. So Ernie, I'd like to ask you to just describe for us the vaccines that are available and what are they effective at preventing? What's the goal of those vaccines?
Thanks. If you can put the slides up for me, let's look at some numbers really quickly before we get into the vaccines. We know what the impact of COVID-19 infection has been around the world. I've selected a few key regions here. And if you look at the first two columns, you can see the total number of cases per million and the total number of deaths per thousand, which have occurred in those regions. And these numbers are up to date as of last evening. Globally, over 2.5 million fatalities. In the United States alone, over 500,000 fatalities were surpassed yesterday. One of our best means of getting out of this pandemic and preventing further infection, further cases, and further fatalities is to get vaccinated. Vaccines, and we'll look at these in a second here, have been being administered in the United States and across the world since mid-December. We started administering COVID-19 vaccines here at Concordia in early January. We can talk a little bit more about that. If you look at the next three columns there, you can see the amount of vaccinations which are being done in each of these regions. If you look at the United States right now, as of yesterday, 19 per 100 people have been vaccinated, 13% have received their first dose, and getting close to 6% who have been fully vaccinated, meaning they've received 2 doses. If you look at Wisconsin and Michigan, you can see the total number of vaccines which have been given to date in red. And then you can also see the percent in terms of the population who has received at least 1 dose and the numbers who are fully vaccinated. take a look at Wisconsin, and we are now getting close to 50% of all individuals over the age of 65, those who have the highest risk of mortality due to COVID-19, having received at least one dose. If you take a look at some other countries such as Mexico, Canada, and Brazil, you can see that they have much lower amounts of vaccines given out. If you take a look at the United Kingdom, they're doing something very interesting here. They've got close to 30% of their population having received one dose of the vaccine, but less than 1% who are fully vaccinated, meaning that they've received both doses. That's a little bit of a change in their strategy compared to what we're doing here in the United States, and I'll show you data on that here in a second. Israel by far is surpassing every country in the world right now in terms of the total population that they have been able to get one vaccine to, as well as their population who has been fully vaccinated with both vaccines. Now, if we go to the next slide, we can take a closer look at what we have available here in the United States. Currently, we've got 2 RNA vaccines, one from the Pfizer company and one from the Moderna company. Those were given emergency use authorization in December. These are vaccines which are given you receive 2 vaccines, one at time 0 and then repeated again in 3 weeks or 4 to 6 weeks, depending on which of the 2 you are receiving. Those are both RNA vaccines. They are going to stimulate your cells to create a viral protein called the S protein, and then your immune system is going to mount a response to that S protein. Both the Pfizer and the Moderna vaccines have shown outstanding response by both the B cells, the cells making the antibodies, and the T cells, the cytotoxic cells, which are directly destroying your own cells, which have been affected by the viruses. If you look kind of moving down the first 2 columns here, you can see that Pfizer and Moderna have over 90% efficacy in preventing symptomatic COVID-19 infection in individuals who have received both doses of the vaccine. Even with one vaccine, 2 weeks after receiving one vaccine, you can see that protection is already there, but you need the 2 vaccines to get to that full protection. What's really important is understanding that severe disease and deaths have markedly been reduced, almost to nothing, in individuals who have been fully vaccinated with both Pfizer and Moderna. Now we have this concern of these VOCs, variants of concerns, new mutations in the virus, which are circulating the globe. One of the new mutations, or one of the variants of concerns, is referred to as the UK virus, highly prevalent in the United Kingdom, origin in the United Kingdom. And at least with what we've seen with the Pfizer vaccine is even with that variant running amok in the UK, they have still seen better than 80% drop in the number of hospitalizations and the number of deaths being experienced due to COVID-19 in that country. And again, the majority of those people are being infected right now with one of those more aggressive variants referred to as the UK variant. Very interesting data coming out of the United Kingdom and Israel this week, showing that even with one shot of that Pfizer vaccine, better than 70% efficacy in preventing COVID-19 infections. Within the next week or so, we should see a new vaccine being released to the United States. It's a Johnson & Johnson vaccine. This one's a little bit different in that it's using a DNA as opposed to RNA nucleic acid. But again, you're mounting pretty good responses to both that viral protein by a B cell response making antibody and a T cell response creating those cytotoxic T cells. Now, you've seen in the media that the overall efficacy of the Johnson & Johnson vaccine is lower than what we see with Pfizer and Moderna. That's the protection that you get against protecting yourself against a symptomatic infection. But what's really important to understand about this vaccine is that it is 85% protective against severe infections, something that would land you in the hospital And there have been 0 deaths in individuals due to COVID-19 infection in people who have received the Johnson & Johnson vaccine. That vaccine was studied in the United States, United Kingdom, South America, and South Africa, countries where these variants of concerns are running amok, and the ability of that vaccine to prevent severe infection and fatality is outstanding. People are going to ask, when this vaccine becomes available, should I wait or should I take it? Should I wait to get Pfizer and Moderna, or should I just take the Johnson & Johnson? I think everybody pretty much who's following this says, when your turn comes up, when you're called, you get the vaccine which is available for you, because right now we don't have a menu that we can offer you where you can say, oh, I'll take that one, I'll take that one. No, when the vaccine comes available, take the vaccine which is available to you.
So Ernie, do you think that everyone should get the vaccine?
I think that everyone who is eligible to get the vaccine at the time that their eligibility comes up, they should receive it. There are few contraindications to the vaccine. One of the biggest contraindications to the vaccine has to do with your underlying allergic history. And for people who do have significant allergies, they probably want to discuss with their own healthcare provider whether or not they should receive that vaccine. And if they receive that vaccine, where should they receive it? Probably ideally in a hospital setting as opposed to a community setting.
Mm-hmm. So many of us have probably heard that there are a number of folks, and maybe some people in this webinar today, have concerns about the vaccines, about some of the potential side effects, or some wariness about taking these vaccines. There's a question in the chat about a concern about the fertility in young women. So I'm going to ask Dr. Pollyanna Cabarra to respond to this. What are some of the concerns we have heard or that are out there about these vaccines? And how do you respond to those concerns as a healthcare provider?
Thank you, Leah. Yes, I'd love to address a couple comments about children receiving the vaccine, and then also being a female as a mother about fertility, pregnancy, and breastfeeding. As far as when children will be able to receive the vaccine, we do not have data on that yet. Pfizer studied down to the age of 17 years old, but right now there is not a vaccine that children can receive. And children will be very far down the line because most children do very well when they do have COVID, are infected with COVID-19. What we do know about pregnancy and COVID, and I did put a link into the chat from CDC. What we do know is that women who are pregnant and get COVID-19 are more likely, about 18% more likely, to end up in an ICU. They're also more at risk for having preterm labor. What we know about the vaccine so far is that we have not had any increase in preterm labor with pregnant women who have received the vaccine. So my oldest is 18. I'm going to pretend she's 25 and married. If she were 25 and married and wanted to get pregnant, I would say you need to get this vaccine when you're eligible for it. If she were pregnant, I would say you need to get the vaccine. If she had just had a baby and was breastfeeding, we don't have data on that. So this is where you need to talk with your provider and you need to just think about it and pray about it. Personally, if it were me and I were asking myself if I would breastfeed and have the vaccine, I would, because I trust the studies that have gone into this vaccine, and I trust the type of vaccine it is mRNA. Another concern that comes up has to do with fertility. And I've had students, when I vaccinated some of our 1A health profession students, ask me some just fabulous questions. And one student asked me if this would impact her future fertility. And my answer to that is, we don't have any data that would say that receiving the vaccine would impact fertility whatsoever. I want all 3 of my kids to get this vaccine, and I plan on being a grandma someday. So I'm not worried about that whatsoever. What we do know is there are viruses that can impact fertility. Mumps is a great example of this. So your children, and hopefully all of the adults on this call, have received the MMR, measles, mumps, rubella vaccine. And the mumps part of that, in men who have had mumps as a younger person, it can cause male sterility, and they then would not be able to have children. So for myself and for my children, I recommend receiving the vaccine, and I'm not concerned about fertility problems. One other question that typically comes up with my parents of my patients is, will the vaccine change my DNA? No, the vaccine will not go in and change your DNA at all, so you don't have to worry about that. And the last question that I received quite a bit from my healthcare profession students and my colleagues is, will employers require the COVID vaccine? And what I can tell you from my personal experience and my educated guess is that in the future, I anticipate that employers will require this of healthcare providers. I'm already having some placements for my PA students where in order to rotate at certain hospitals, they have to have proof that they've had both of their COVID vaccines. Because it's currently emergency authorization use, employers are not mandating it right now. However, I suspect that will be changing in the near future. So I highly recommend everyone, especially healthcare providers, but everyone to get that COVID-19 vaccine. I've had both of mine, and I'm just so blessed to have had that opportunity as a PA. Thank you, Leah.
Thank you. So once someone is vaccinated, what can that person then do? Like, can I go visit grandma and give her a big hug once I've had my vaccines? Can I take my mask off and throw it away and run into a restaurant or a crowded bar? And I'm going to ask Dr. Beth Griffin if she would respond to this question. Once we're vaccinated, and what behaviors should we be displaying after that?
Yeah, that's a great question. And certainly, you know, we're hopeful to get to that point someday in the future. But right now, I think when we look at the vaccine, we have a lot of tools in front of us right now to help mitigate the spread of that virus. And certainly the vaccine is the most powerful tool, and especially the, you know, one we have the most data on now in preventing us getting the virus and hopefully spreading the virus as we learn more. And we're still getting data on our ability to spread the virus, even if we're asymptomatic once we've been vaccinated. So we don't have all the data on that yet. And we don't know for sure yet. We're working on getting that, and I'm excited to hear more information soon. But I think the point is nothing is 100%. Even these vaccines, which are amazing to be in the 90% range for efficacy, which is phenomenal when we talk about vaccines, still are not 100%. And if there's other things that we can do on top of being vaccinated that we know already, things like watching our distance, washing our hands, wearing masks, those things that we've been doing, absolutely, we should layer those on top of our vaccine and really do the best that we can to help mitigate that spread until we reach a point in our community in the future where we are able to potentially change behavior. But right now and in the near future, absolutely, we need to continue doing all those things that we know that we can do to help mitigate spread and to help keep those around us safe, and of course, our families and ourselves safe.
Thank you.
I'm curious what the panelists would say, Leah, about this idea of requiring vaccinations. And we've had a few questions come in along that too. I don't know if you want to, we could take a few, I won't move us on. We have a few more minutes we could take on that one if people are interested in discussing that.
Yeah, so that's a great question. So anyone on the panel wants to respond to that. Do you think that vaccinations will be required, for example, by employers to get on an airplane, to go into to go attend a concert? What do we think about that?
Well, personally, I hope that that the data on these vaccines gets out and people see the importance of these vaccines and make voluntary choices to have themselves get vaccinated. That's just me. I think that people should have their choice in terms of what they are going to do. But I think the efficacy of these vaccines in preventing serious disease, and more recently now showing the ability to prevent transmissibility, that's what gets us out of the pandemic. And I hope as healthcare providers, as we see this information, we learn how to convey that message to different communities, and vaccine hesitancy and vaccine complacency starts to drop.
Thank you. And there's a great question in the chat, which I've wondered myself, and that is, if someone has already had COVID and had positive tests and knows that they were infected, should that person still get the vaccine?
I got some information on that. So they've been measuring the antibody titers in individuals who had natural infections, and they tend to be all over the board. And I mentioned that this coronavirus is the largest RNA genome of any coronavirus. We think there's something in there that's subverting the immune system. And in a lot of cases, we're not getting a strong immune response. However, with the vaccines, we've seen a really consistently high titer response with the antibodies. So if you had the natural infection, you might be protected, you might not. But if you get the vaccine, that's very consistent, and we know where you're going to be at protection-wise.
So you're actually saying, Justin, that the vaccine is better than the natural infection. That's really interesting.
Yeah, it's an odd case for this. Yeah.
Yeah.
Yes.
And if I had, oh, go ahead, Gretchen.
Well, I'm going to move us.
All right,
Because
good.
we want to get into this third part, the science, the medicine, and now the ethics. And so, Leah, I'm going to invite you to set up our next presenter, and then I know our panel is going to have a lot to say on this last one. So
All right.
I'll push you along to that one.
Thank you. Well, our next presenter is Dr. Kevin Voss. And Dr. Voss is a professor at Concordia where he teaches philosophy and bioethics. He's the director of our Bioethics Institute. And it takes a while to tell you all his credentials because in addition to a PhD in bioethics, he is also an ordained Lutheran pastor and he's a large animal veterinarian. So he really blends the scientific knowledge with the knowledge of ethics and Christian faith. So Kevin, could you just maybe give us a little bit of an overview of some ethical considerations that we as Christians should be thinking about together with when we're making a decision about getting a COVID vaccine?
Sure, thank you, Leah. I'd be happy to. If I could have my slides up too for the group. The first slide has a list of helpful resources, which are from Lutherans for Life, from the LCMS, from the Roman Catholic Church, and the Christian Life resources are on there. So when that gets up, we can look at that. And then the second slide has to do with ethical concerns, which I'll run through. So should I share my screen or? Okay, I think Gretchen has got her finger up and there we go. So if you could just go back briefly to that first slide. Yeah, I'd be happy to share those with anyone who wants them. Those resources are all online. So now Lutherans for Life also has a position statement on vaccines. Now, if I could have the second slide, here are just a partial list of ethical concerns, and some of them have been addressed here, like the risks and benefits. And then mandating vaccines, there's a conflict between personal freedom and the good of society. Some misgivings about the provision of healthcare in this country. Some groups are more distrustful of our healthcare system than others and perhaps won't seek out the vaccine. Some suspicions about the pharmaceutical industry, big pharma, and how much they stand to profit from the whole COVID pandemic. Fair distribution of COVID-19 vaccines, that's an issue we deal with daily here. And then I'm going to deal with the last issue, the use of vaccines developed from cells derived from aborted fetuses. So just a couple words from the LCMS, first of all. The LCMS and convention has repeatedly adopted resolutions supporting the sanctity of human life and opposing abortions. And it has not, however, officially adopted a resolution about the use of vaccines deployed from or tested using fetal cell lines. So it has not officially adopted a resolution on that. However, almost every source that I've consulted says that we should do all we can individually and as church groups to encourage the development of COVID-19 vaccines without using fetal cells derived from induced abortions. And if we're aware of vaccines that are developed without using those fetal cells, then we should try to use those. Now, the next slide is a screenshot from a website that I thought was helpful and also has been referred to the Lutheran Church Missouri Synod by President Matthew Harrison, is the Charlotte Lauzier Institute. And they've got teams of scientists and ethicists that look at how various vaccines have been developed. And you can note that, there's actually two phases to the vaccine, is how they're developed, how they're created, and then how they're tested. So you can see that the first two on the list by Pfizer and Moderna, which are the two available right now, have not been developed with the use of abortion-derived cell lines. They may have been tested with fetal cells, although we don't know for sure, but it's questionable. Some do, some don't. You can see that there are some vaccines on the list that have been developed with the use of abortion-derived cell lines. So sometimes as individuals, we don't know how the vaccines are derived or tested from induced abortions, spontaneous abortions, or fetal cells taken from other sources like a biopsy. And the researchers themselves might not even know. So therefore, if we could have the next slide, I found that the principle of material cooperation is helpful in troubling issues like this when we're contemplating whether or not to carry out an act that is intrinsically evil, which for us would be abortion. As long as our intention is not to do evil, which would be formal cooperation, which is always wrong, we're separated from the original evil act, abortion, in terms of time or space. In fact, we've had nothing to do with that. And some of these cells were developed in the 1970s that we had nothing to do with. And we participate because of extreme duress, saving lives. Then we may be justified in materially cooperating in that act. In other words, we participate, but not directly. One author uses an organ transplant as an example. And all examples are imperfect, but I thought this is thought-provoking. Even though we might receive an organ from someone who is tragically murdered, it does not mean we are morally complicit in that act, even though we derive benefit from it. So then the next slide kind of summarizes my perspective on the issue. I'm not speaking for the LCMS or any other group other than the Concordia Center for Bioethics. So therefore, I think the most rational and biblical approach to this issue is to encourage LCMS Christians to use vaccines not derived from aborted tissues if they have that choice. Consulting pastors, and of course, going to conservative Protestant or Roman Catholic physicians, nurse practitioners, physician assistants, or pharmacists for the vaccinations might be wise options so an intelligent discussion can take place. If Christians don't have that option, if they don't know how the vaccines are derived or the distribution doesn't enable them access to vaccines that clearly were not derived from aborted cells, then I believe they're still morally justified in receiving a vaccine derived from questionable techniques because their intent is not to promote abortion. Their overriding duties are to help their neighbors by preserving defenseless lives and to work for the welfare of society by preventing more illness. So I think this perspective is in keeping with two important biblical principles, the golden rule, do unto others as you would have them do unto you, found in Matthew 7, and the second greatest commandment, love your neighbors as yourself, is found in Matthew 22. And then just one last word, if at the same time we ask God for forgiveness through Christ for sins known and unknown, if we've made an error in judgment. And just one last thing I want to add about mandating the use of vaccines. The LCMS has come out with a document that says this: Christians should respect the consciences of one another on a question where Scripture and Synod have not spoken expressly. So no matter where we fall on the issue, we should not be judgmental about it. Is essentially what that document is saying. Okay, those are my few words on the topic.
Well, thank you, Kevin. Well, those are some really serious ethical considerations, and thank you so much for going through those with us. What about, and this is for anyone on the panel really, what about the ethics of receiving a vaccine? So suppose I am not in one of the early groups in the high-risk categories, but a vaccine is available to me and I'm offered it. Is it ethical for me to take it, or is that jumping the line somehow? What do we think about that?
I'll tell you that at Concordia, we are getting close to having administered over 1,000 vaccines, and we have not wasted a single one. We do our best to line up who is eligible based on the criteria delivered to us from the state of Wisconsin. And as we get towards the end of the clinic, if we find ourselves that we've had a no-show and maybe one or two vaccines are available, those will never get wasted. We will always have a list of individuals who are eligible, who can be called on the spot and say, hey, can you get here in the next 20 minutes because we've got a vaccine for you. So I am quite proud of the fact that not one vaccine has been wasted at the Concordia Clinic. And I am, and that is the kind of like what state of Wisconsin has said, don't put it in the trash, put it into an arm.
Mhm.
Yeah, and just to comment, to follow up with Ernie's from an ethical perspective too, I agree with what he says. I think intent is important here. If the intent is to jump the line and to get the vaccination from someone else, which we've seen potentially reported in the media in some instances, then that would be an ethically troubling act. But if the intent is not to jump ahead, but the vaccine is there offered to you, I think you're ethically justified in receiving it.
Anyone else want to comment on that question? Okay.
Well, Leah, I think we can transition into that kind of closing discussion, and we want to hear from all of our panelists. But guests who are watching, please do feel free to post in the Q&A. We've got panelists who are responding kind of real time, which is awesome, and sharing links and resources, so it's very beneficial. But let's open up and go to this final discussion, and just Leah, go ahead and open that up, and you all talk freely. We're learning a lot.
Yeah, this is great. Thank you. So we are getting close to a year since the big shutdown happened, which was the middle of March last year. A year ago today, I was on a trip with my husband in Egypt, trip of a lifetime that we saved up for a long time. And in our group of 14 people, 2 of the folks on that trip got COVID on our trip, and 1 passed away when we got back to the United States. So that hits home really closely for me because he was one of the first people, I think, in the United States to die from COVID. So it's been almost a year. That's not an anniversary we want to celebrate, but it is one that's coming up, and maybe it's not unprecedented any longer when we've been living this way for a year now. So I'd like everyone in the group to just to reflect on and share with us, considering the science, the medicine, and the ethics of all that we've gone through this year, how do you think Christian people should approach this next phase, these next few months of this pandemic? And Christine, maybe you would want to start out talk a little bit about how do we as Christians care for our neighbors, especially when their views on this pandemic and how should we respond to it might be different from ours.
Sure. Thank you so much, Leah. A lot of the phone calls that I've been fielding have been, my brother or my sister or my parents don't agree with where I stand on COVID or even the vaccine. So it's kind of talking people through some communication skills and maybe some assessment skills as well. So I know that we've had just a plethora of incredible information here today, and some people may want to just gather it all up and share it with everybody they know. And I guess I would ask them to kind of take a pause, take a deep breath, kind of assess yourself, see where you stand on these issues, and see if you're having conversations with only people you agree with. That may be a very encouraging conversation, but to take that kind of conviction and talk to somebody that may not agree with you might not be so appropriate. So maybe kind of assess yourself where you sit with that. I think the other thing is that if you're going to talk to somebody, so Leah, I'm going to use you as an example. So let's say I am for the vaccine, and I know that you are just against it 100%. One of the things that I would do with you is to actively listen, right? And not try and convince you of my way. If we're going to have a Christ-centered relationship, which I think is the goal for Christians, then let's start there. So I'm going to, just listen and see what you're saying. You may just need someone to bounce stuff off of. You may be just verbally processing what you think you know. If you ask me a question, then that's my time to come in and maybe ask some more even probing questions. So not like if I came up to you, Leah, and said, hey, did you get the vaccine? Or did I go, Leah, did you get the vaccine? I mean, it's all in delivery. And so if I truly care about you and I want what's best for you, even if that's different than my premise or where I stand, then I have to be willing to, like I said, kind of invite the Holy Spirit into our conversation, and that we can talk. So asking open-ended questions rather than yes or no questions is really good. And I think the other thing is listen for some emotions. Almost everybody I've talked to, they're just emotionally charged. So are you angry? Are you fearful? Do you have some grief or loss? I think that when we understand where someone is coming from, that can help the dialogue that we have between each other. And I think that's then maybe where the compassion can come out of, if I understand that you're coming from fear because you've lost several family members. That's going to be a different conversation than me trying to convince you that you need the vaccine, or me convincing you that you shouldn't. We talked earlier about where you're getting your information from. Did you see something on Facebook? Is it an article you read? I had a parishioner that was loaded with articles, and unfortunately, none of them were from valid sources. And one of them, I think, might have been from a pharmaceutical company that didn't even have any skin in the game when it comes to vaccines, but they wanted to get their name out there. So, someone said, if it bleeds, it leads, that kind of information. So I think, again, trying to figure out where somebody comes from, asking some questions. And the other thing that I really want the listeners to hear is that if you do go and get a vaccine, remember that all of this is being performed, at least in Michigan, I'm going to assume the same in Wisconsin, by volunteers. So you have healthcare professionals that not only, whether they're working an 8, a 12-hour shift, or they are retired, or they're not doing bedside nursing like myself, all of this is being performed by volunteers. So in spite of maybe some anxiety going and getting your vaccine, it doesn't hurt to say thank you.
Thank you so much, Christy. That's such good advice. And I can say, having been to the clinic here at our campus in Wisconsin, that all the volunteers there, they were all volunteers, students and faculty and staff. And it was so inspiring and so wonderful to see them serving all of us in that way. Anyone else on the panel want to talk about that a little bit? How should we as Christians respond to this situation, and especially to those who might have a different perspective than we do?
I can briefly respond. This is Kevin again. And I just like the LCMS has emphasized in its documents from President Harrison and the Commission on Theology and Church Relations, that we should respect Christian consciences in this issue. And then from a philosophical perspective, that we want to deal with other people with civility. We kind of pride ourselves in philosophy for doing that, even with those who, with whom you disagree. And then I think the golden rule applies here too, as I mentioned, doing unto others as you would have them do unto you. So try to treat people with respect, and respect that they have human dignity equal to yours, because they're also created in God's image.
Yes, thank you.
I would like to just say from a pediatric standpoint that I believe it is our job and our calling from God as adults and people who are able to receive the vaccine. So I've received it because I'm a healthcare provider. And then to all the people, as soon as you're eligible, in order to protect those who are not eligible to receive the vaccine yet. So an example I like to use is that all of us adults, when we go to get our tetanus boosters, we receive a tetanus booster that has something called pertussis in it. We receive that pertussis component of the vaccine in order to prevent young babies who are too little to get pertussis vaccine from getting pertussis and dying. It is our duty, those of us who are able to get the vaccine, to get it in order to protect all of those who are not yet eligible and all of those in whom it is not studied yet.
Gretchen, do we have time for a few more responses, or should we move to the Q&A?
We have time for a few more responses because you all have been so on it with the Q&A, answering as we don't have any open questions right now because our panelists have been answering while we've been going. So attendees who are listening, now is a great time to drop any last questions you might want to hear answered into the Q&A. But I would love to hear just a closing comment, response to this final question, or just a general closing statement from any of our, I'd love to hear from everyone on our panel.
Yeah, maybe a quick closing statement from each of you. Can I call on you in turn? Kevin, could you go first, please?
Sure. I just think, this is my perspective, that I think our duty to take care of ourselves, which is biblical, and to take care of our neighbors and to do good for society, concern ourselves with the common good, I think we should consider receiving these vaccinations, even though we may have misgivings. And I think those three duties in general outweigh other concerns.
Thank you. Ernie, a couple of closing thoughts?
I would say if you have vaccine hesitancy, get your information from someone that you trust. Talk to your healthcare provider, talk to your friends or family members who are healthcare providers. Be very leery of what you're seeing on social media. Talk to the individuals who have been looking at this and studying this and are actively involved with this. The COVID vaccines, particularly the two that are being offered in the United States right now, have been in circulation since July of 2020. They have gotten into mass circulation since mid-December of 2020. A lot of questions have come up on the chat here and on the Q&A regarding long-term side effects. So you're correct. The vaccines now have been out somewhere around 6 months or so, maybe a little bit longer. Historically, when severe reactions have occurred due to vaccines, those have always presented within 1 to 2 months of that vaccine being out in the public. We are well past that time, with millions and millions of vaccines being given in the United States now. We're at a point where we're given over 1.5 million doses of vaccines per day. And there has been, no matter what you hear on social media, there has been no signal of any severe complication due to these COVID vaccines.
Thank you, Dr. Stromsky. Christy?
Thank you. I put my phone number in the chat. If anybody wants to have, I put like a deeper conversation or any questions, I'm here to serve. I think that it's important that, we use this term, trusting therapeutic relationship, right, in healthcare. And I think it's important that we maintain that. So if anybody would like to talk further, I'm available.
Leah, let me come back for 1 second and just make a clarification on this long-term thing. So there are certainly individuals who have received the COVID vaccine and developed something bad. As an example, one thing that's out right now is there are individuals who have received the COVID vaccine, and with a week or so of receiving that vaccine, they've developed a disease. One of the diseases that they have developed is called ITP, where your body starts destroying its own platelet cells. That disease is prevalent in the community no matter what. There are many causes of that. What we need to look at is if a person or a group of people have developed this disease following the vaccination, is that at a higher rate than what is normally occurring in the community or within the population? And again, there are people who are going to get this vaccine and within a week or so are going to develop something, maybe ITP, but people are always going to be developing something like ITP with or without that vaccine. What we need to look at really, really closely is in individuals who've developed, in my example here, ITP after the vaccine, is that rate significantly higher than what's the baseline amount of ITP in the population? And again, with respect to these things that happen within the population, so far we are not seeing any increased amount of these diseases based to what is already there in the community anyway.
Thank you. I think that's such a good point, Ernie. And I think it's easy to confuse correlation with causation. Maybe some of the people who got that ITP also ate a banana the day before they got ITP, and you could draw the conclusion that the banana caused the ITP, but that's probably not the case. So we do want to be careful about making those connections. Beth, how about you for a few last thoughts, please?
Sure. A few last thoughts. I think kind of overall thinking about the vaccine, my perspective as an emergency medicine physician, serving on the front lines. I've had the honor and privilege of treating a lot of patients, but also seen really the devastating effects of COVID. And so when we talk about risk versus benefit, we've heard today there's very minimal risks, allergies being the major, contraindication, but otherwise not seeing really a lot of risk associated with that vaccine. And the benefit that we see, certainly we all see this from different lenses, but from my perspective, seeing patients who have been devastated by this disease, seeing families devastated, and our community certainly, I would say obviously benefit way far outweighs, any small potential risk that we might not, know about at this point. And I think we've talked through a lot of the great science behind that as well. I think as a Christian, I see our duty to first do everything in love. These conversations we're having, how we're treating others, how we make these decisions, it's all done out of our love for God and of course our love for others. And also it's our duty to be as informed as we can be. And so what God has given us in terms of our resources and our own intellect, it is our duty to be informed in how we approach these in love, in conversations and in decision making. I think God has blessed us with the knowledge, the technology, the infrastructure to have these vaccines. I see these as a gift during this pandemic from him. And I'm certainly very grateful for it. And I think we've been blessed by it. So I'm always happy to answer questions as well, and happy to post my contact information, email in the chat if anyone has any questions from my perspective. We've kind of talked a little bit too about how this has specifically affected African-American patients. And I'll say as an ED physician who works at St. Joe's Hospital in Milwaukee, I have the opportunity to serve that population. We've seen, unfortunately, effects in those populations that have been more devastating in terms of morbidity and mortality than other populations. And we have a lot of really important and robust efforts to be connecting with our communities in those populations, in those areas, connecting with pastors, connecting with local organizations to make sure that we're able to connect with people to answer any questions they have. If there's vaccine hesitancy for whatever reason, to really be able to answer and speak to those. And then finally, to make sure that the vaccine is available to those patient populations the same as it would be to any other population. And that is really a very important endeavor that we are continuing on, and just really, I think as physicians and health systems appreciate really the whole community coming together to do that.
Thank you so much. Pollyanna, last thoughts?
Yes, my last thoughts are that it takes a village. So I'm blessed that I'm a PA and I'm able to give vaccine here on campus. That doesn't make what I'm doing with that any more important than what other people can do. So sometimes just putting this out there, putting the link to the Facebook, this webinar today on your Facebook page or in your social media, sharing this webinar with other people. That is going to be way more important to spread the word than me putting a couple vaccines in someone's arm. So do what you can. If it's vaccinating, it's vaccinating. If it's promoting truth and information, that's great. If it's posting a link, that's phenomenal too.
Thank you so much. And I think, Justin, we started with you. We'll let you have the last word.
Oh, thanks. Be patient. The vaccine effort, the efficacy is looking at prevention of disease, not the spread of the virus. So the virus can still be spreading. We now have a selective pressure on the virus. So we're getting variants popping up. It's still going to be a while before we reach this ultimate goal of normality again. So be patient. As Christians, we respect authorities, and even if we don't like it, we need to follow the laws and our government and what they ask us to do, and be respectful of them. Thank you.
Thank you.
Wow, Dr. Dvorak. Oh, look at that. It is so like on point for you there. Is that a brain on there? Mm-hmm. Very nice. I love it. I love it. Dr. Dvorak, thank you for facilitating this panel today. And panelists, thank you so much for sharing your expertise, for leaning into these values of life and health and wellness with us. We had a whole lot of people watching online, on Facebook, here in the webinar. Guests, thank you for joining us today. And we'll have to do this again, friends. I mean, this was really a lot of fun to have everyone together. But God bless. Thank you. Stay well, stay healthy. We always talk about living hearts together at Concordia University. We truly are in this together. God bless. Bye-bye.